What is your focus now?
Our focus would be on globalizing. So we want to be known not as an Indian CRO, not even as a regional CRO. We want to be known as a global CRO. So we've started operations in the US, as I mentioned, 11 countries in APAC. We're also looking at Sweden or Switzerland, one of the European bases. So we want to go global. That is one thing our focus would be on. Second is that we want to move up the value chain, over a period of time. So we started as a contract research organization doing the lower end studies. Now we went to higher end studies. Now we want to get into co-development, marketing, strategic consulting. So we want to move up the value chain as a company. And I think some of the other things as I mentioned, that we are looking at the corporate social responsibility piece very seriously. So this year we are working on acquiring some novel drug candidates for tuberculosis, and we would spend the next 3 to 4 years developing or co-developing some of these candidates and taking them to market. And we believe that if we could find a cure for tuberculosis, especially the multi-drug resistant, extreme drug resistant and total drug resistant varieties of tuberculosis, we would have made a huge contribution at a social level also.
How is the current working?
The current working remains the same, that we are a CRO. We are meeting our planned numbers. As I mentioned, we are doing almost 150% growth in terms of revenue. In terms of EBITDA, we are a little over 20%. Our attrition rate is under 12%. And the new business kind of acquisition, we are acquiring almost 20 plus logos in a year, and also 70% of our business is repeat. So in that sense, I think the working is exactly as planned, and we are now looking at the B Series B round of funding and real growth after this point.
What is your competitive edge?
See, Karmic has consciously built a whole layer of competitive advantages. The first part is that we are a global CRO. So when we say we are global, we are not just talking about delivering through partners. We have our own people in almost 15 countries across the globe right now. And we are slowly expanding to strategic bases such as South Africa, Brazil, China, Eastern Europe. So that is the first thing that gives us an advantage. And plus we have a very strong regulatory know-how for EMA, for US FDA, for various APAC regions, for South Africa, PMDA, all these different regulatory bodies. The second thing that gives us a competitive edge is the fact that we have very, very deep therapeutic expertise in areas such as oncology, diabetes, cardiovascular, infectious diseases, and we have a layer of almost 6 senior medical doctors who are extremely proficient and with very, very strong scientific backgrounds. So plus we are working on novel biomarkers, novel diagnostic techniques, etc. And the third part is that given my own background is from IT, it made a lot of sense to apply some of my learning. So the fact that we have an IT solution which is end-to-end, which has an electronic data capture, a clinical trial management system, an SDTM mapping tool, an ADAM mapping tool, an electronic trial master file, and we are working on making this iPad and Android platform enabled. We are trying to integrate it with electronic patient reported outcome devices. We are trying to see if we could capture data directly from the source using biosensors and chips. So I think the IT piece is the third biggest competitive advantage for us. And I think the last one would be the sheer passion of the sales team and the fact that we offer very flexible commercial models, and we offer consulting services and not just execution. So I think that whole models, the engagement model piece is again a strong point for us.